So the Sacramento Regional Family Justice Center is one of about 30 in California, and we are a one-stop center for victims of domestic violence, elder abuse, human trafficking, sexual assault, and child abuse. And collaboration is core to our mission. So we do this work in partnership with public and private agencies throughout the region, as does each Family Justice Center in California. Clients can walk in, get the services they need, all under one roof, whether it's physical or virtual. And we make sure that if somebody comes in, they get all the wraparound services they need in one place, so that they only have to tell their story one time, because it's often very traumatic to have to do that repeatedly to get what they need, to move from a place of danger and trauma to one of safety and hope. So there are myriad ways that we can help the victims who come into the center with the offerings that we have. So each client comes in and meets with a case manager who will then hear the story and determine what all that person may need. So we can offer support through counseling, through support groups, through peer counseling. We have specific programs that we can help.
We have a team of social workers on staff who work with survivors of domestic violence, sexual assault, human trafficking, elder and child abuse. We have a housing program where we can provide services for victims who are escaping. We don't have a shelter program, but we can help them financially, maybe pay their rent or their deposit or their moving expenses. We have a human trafficking program that I'm very proud of. We have the first Sacramento County Human Trafficking Hotline. We have a legal team. We're the lead agency in Sacramento that does domestic violence and elder abuse restraining orders. We also have a child therapy program. We have a program called CATCH. It stands for Children and Teens Creating Hope. So in the CATCH program, we have what's called Camp Hope America, where we send kids to camp every year in the summer where they get to be kids. We also have a gang violence prevention program. A couple other programs that we have is our Health and Wellness Center. The goal really for the Health and Wellness Center is so we can start doing what's called a forensic exam for strangulation. We have a comfort dog. His name is Buddy. He goes around and gives us all comfort, and in particular our clients. We also have different partners on site, different partner agencies on site who do stuff. We have like Adult Protective Services on site, Child Protective Services, their Safe Center.
So our services are essentially limited to Sacramento County, and that is because we do so much with the family courthouse. Anyone and everyone is welcome to come into the Family Justice Center. We don't focus on immigration status, for example, or prior histories. So people can just walk in, receive the services, no questions asked, really. Everything that we offer here at the Family Justice Center is free. We are open from 8:30 to 5. Every day, Monday through Friday. A victim can come into the Family Justice Center just as many times as needed. At this point, our legal team is able to help assist with restraining order petitions. We right now don't have the capacity to do extensive family law, but we hope that we will be able to offer that very soon.
Another part of our legal team is we do what's called mobile outreach services. So we've had several individuals who are in the hospital as a result of domestic violence. They've been injured, they can't get here, and they need a restraining order. So we'll send an attorney along with a case manager to go there together, so the case manager can offer support and then the legal team can do the restraining order. We also do, on our legal team, we do what's called a court preparation workshop. So we will prepare them, that's in a group setting. So people can come in every Tuesday and learn about what's going to happen in court for them. But we do it one-on-one, it's highly confidential, it's between the attorney and the client. Advocacy is a big part of our program. So if someone needs an interpreter, we can advocate for them to have that interpreter in court. We also partner with a program called Deaf Safe for those who are hearing impaired. So we want to make sure that they're able to get their restraining order, or their counseling, and their support too. And so another project we have though is what's called our Hidden Homicide Project. So this is where we've seen it here at our Family Justice Center, where someone might share, my son or my daughter or my loved one died as a result of suicide, when in fact, when you gather all the information, there was a lot of questions saying maybe this wasn't a suicide, maybe it was a homicide.
So when a victim first comes into the Family Justice Center, they need to fill out a brief intake form. And then they are assigned to a case manager who meets with that person to hear his or her story, to understand what it might be that this person needs. Many times the person comes in and says, I need a restraining order, and may not be aware that there's so much more that is available to them. One of the first things that case managers does with the person after hearing this story is to go through a lethality assessment, and that helps to understand what level of danger that person is in currently. They may not feel like it's as bad as it is, but using this tool that we have, asking these specific questions, then we can rate them. And oftentimes what happens is the person realizes when they look objectively at this that they're in significant danger, but they have learned to survive. And so, they've acclimated, if you will. So that's really important. And based on that, then, we do a safety plan with that person. Every person who comes in leaves here with a safety plan. Then what happens is that this array of services is set forth before them, and together, because it's important that the client be empowered to make decisions for him or herself. We make sure that when they leave here, that they have the resources they need, the follow-up they need, that the door is always open.
I think that the thing that we do really, really well here is crisis intervention, safety planning, advocacy. Those are like the main top three things that we really do here for every one of our clients. The last thing I want to say, if someone is experiencing domestic violence or human trafficking or elder or child abuse or sexual assault, to please seek help. I'm a survivor of domestic violence. I know the impact it can have on yourself and on your children. More information if you need to reach out for help or just want that additional support, it's all confidential. Just go to our website or call us on our phone number.